Good morning, colleagues, and greetings from WHO headquarters in Geneva. I'd like to first apologize for not being able to be amongst you there today, but hopefully this will be the start of many opportunities in the future. So I'm going to go ahead and share my slides. And I'd like to first start with brief concepts or background concepts. So as you all are aware, a diagnosis is an explanation of a patient's health problem, and we reach a diagnosis through a diagnostic process. So the diagnostic process starts with the patient accessing the health system, and then goes on to the history taking, clinical examination, the testing, interpretation of those tests, and reaching the diagnosis, then communicating that to the patient. So this process is not as linear as it looks here. It's quite complex and it has a high degree of uncertainty. Errors can occur at any stage of the diagnostic process. So what diagnostic safety is, it revolves around minimizing or eliminating those errors to prevent harm to patients. So what we would like to achieve is to reach a correct diagnosis in a timely manner with appropriate use of resources while engaging patients, so having them as partners throughout the process, and also with the absence of unwarranted variations among population groups that might be disadvantaged. This also encompasses inclusivity in testing and validation of diagnostic tools across the different various demographics. So, what is a diagnostic error? So according to the Agency for Healthcare Research and Quality, a diagnostic error is one that is either delayed, wrong, or missed, or one that has been correctly identified, but did not reach or was not communicated to the patient in a timely manner. There are many causes of diagnostic errors, so it can occur due to system vulnerabilities, challenges in clinical reasoning, issues with cognitive biases, health workforce competence, breakdowns in the testing and follow-up of care processes, and communication failures as well. So why is it important? Why are we speaking about diagnostic safety? Because diagnosis is really the foundation of the care that we are providing. And diagnostic errors were found to be a major contributor of preventable harm, amounting to 16%. They occur in every setting globally. Common conditions as well as rare conditions are affected. They lead to increased financial burden on health systems. So in a recent report issued by the OECD, this financial burden was estimated to be 17.5% of total health expenditure in a typical OECD country. This has broader implications on the trust in health systems and on the utilization. Whatever research is there or information that we have is also focused only on health high income settings, and the picture is not really clear in low and middle income countries. And despite all of this, only 47% of countries were found to have programs in place systematically addressing diagnostic safety. If we take a closer look at diagnostics and technology, of course, as we've seen in previous years or decades, in the recent decades, there were remarkable advances. But with these advances and expansion of technologies came new risks as well, because we were increasing the complexity in health systems, especially across interfaces, and processes. So there are current strengths. There was much work was done in the analytical phase of the testing process, but gaps still persist in the pre and post analytical phases. So system-wide improvements are warranted across the whole testing process. WHO worked in various areas to improve diagnostic safety. So in the diagnostics arena, where I think Anna is going to speak about that, and also in the area of clinical services and provision of effective care, and in the area of patient safety. So the issue of diagnosis has been included as part of the Global Patient Safety Action Plan, which is paving the way for us up until 2030. And it covers issues like safety of clinical processes, health workforce competence, patient and family engagement, and using of data to improve systems as well. As part of the response, last year, the World Patient Safety Day was dedicated to improving diagnosis for patient safety with the slogan, "Get it right, make it safe." And as part of this campaign, campaign materials were developed, campaign messages to the relevant target audiences, including the diagnostics community, was released as well in relation to other media-related activities, commitments by global health leaders, and practical advice to stakeholders. There was an invitation to light up monuments in orange in the evening of 17th of September as well, as a show of solidarity. So this was part of the one of the materials that were developed. So I'd like to take a few minutes and to show you this this one as well.
Did you know almost all adults will experience at least one incorrect, missed, delayed, or miscommunicated diagnosis in their lifetime? A diagnosis identifies a patient's health problem. Reaching a diagnosis takes several steps. An error can occur at any stage and can seriously harm patients. A correct diagnosis starts by joining the dots throughout the journey. For patients, this means being involved in the process. Think of yourself as part of the healthcare team. Share all your symptoms and medical history. Ask questions, raise concerns, and follow up on test results. Together, let's get it right, make it safe. Did you know?
So this was one of the communication materials, and there was another video, a longer one that was targeted at health workers as well. So as part of the campaign, more than 132 countries have observed the day, including countries where there is active conflict and war, which just speaks to the importance of this topic also. So the countries and partners have marked the day in various ways, ranging from passing of laws, adopting policies, technical activities, capacity building activities, to patient and community engagement activities as well. So as part of the campaign, WHO embarked on the development of a technical report that would highlight the existing information that is out there when it comes to diagnosis. So existing frameworks, definitions, existing interventions, burden of harm. And not only that, not only scoping current information, but also providing an implementation model that would help countries in improving diagnosis. So the model addresses diagnostic safety issues in 4 domains: patients and their representatives, health workforce, systems and processes, and diagnostics and technology, at the different levels of the health system: policy, organizational, and point of care levels. And it provides a matrix of interventions for countries and partners to adopt. So this report was developed in collaboration with partners and subject matter experts. We had a global consultation last year, and Dr. Tomris, we're very pleased to have her as part of the participants and representing IFCC. So it was very important to have representation from across the professions, the health professions, in order for us to get the clearer picture. So the key considerations that came out of that report, or are coming out in that report, is that yes, we still have broader health system challenges to address, such as the issue of access to essential diagnostic services, but there are still specific interventions that are related to diagnosis, such as adopting risk management approaches, or developing competencies of the clinicians in clinical reasoning, in managing cognitive biases, provision of conducive environment and uninterrupted time, for example, for clinical assessment, strengthening teamwork, engaging patients in a meaningful manner, using of technologies, establishing cultures where we would learn not only from errors, but also from positive experiences, and also definitely strengthening research on diagnostic errors and prevention strategies. All these apply to laboratory settings and to laboratory professionals as well. But there are specific interventions that are related to standardization of processes, applying diagnostic stewardship, strengthening the competence when it comes to understanding limitations of tests, for example. So this is where clinicians might not be very strong, and your help in doing that is very much needed. Enhancing interoperability and usability between systems, and also engaging patients when it comes to their results and to their test results. So I have 3 take-home messages. First of all, diagnosis is a team sport. It no longer is just the responsibility of a clinician or a consultant, but laboratory professionals are essential members of that team. We need to build on the successes that are already there to address the safety gaps in the pre and post-analytical phases, and we need to learn from the laboratory community. So sharing the experiences with other health professional groups is extremely important to advance diagnostic safety together. So I'll end with the words of Henry Ford, who said that coming together is the beginning. So this conference is really a fantastic beginning, but we need to stay together to progress and to work together to succeed. Provision of healthcare is a collective responsibility. Healthcare is a human right, but in the words of Dr. Tedros, if it's not safe care, then it's not care at all. Thank you very much. And I'm sharing with you our email. Should you have any questions or require additional information, please do not hesitate to contact me. Thank you very much.